Welcome to Colorado Access's presentation of the ABCs of the Accountable Care Collaborative Program. Our presenter today is Amy Acapo. She's the project manager for Colorado Access RCCO, or Regional Care Collaborative Organization. And with that, I'm going to turn the webinar over to Amy.
Thank you, Glenda. I wanted to also welcome everybody to this recorded webinar. First, I'm going to review the agenda. In this webinar, we will cover the Accountable Care Collaborative ACC program, member enrollment, and how the ACC is about keeping healthcare local. The webinar objectives. So following this webinar, you will be able to describe the Accountable Care Collaborative program, or known as the ACC program, the history, the purpose, the vision, and the core components of the Regional Care Collaborative Organization, or known as the RCCO, primary care medical providers, which are known as PCMPs, and the statewide data analytics contractor, which is called the SDAC. Additional webinar objectives, we will describe how Medicaid members are enrolled into the ACC program. We will review the passive enrollment process, show what the members receive as far as the HCCO member handbook, and in addition, the RCCO welcome packet. We will also explain how the ACC program is about keeping healthcare local. It's really about collective problem solving. Care coordination is at the core of the program. Patient-centered medical home, doing what's right for each community, and why this all matters. So now we're going to cover the ACC program. The ACC program. The program was created in 2011 as a response to the following. So there was mixed performance experience with the Medicaid managed care. 85% of Medicaid members were in an unmanaged Fee For Service IFFS system prior to launch of the ACC program. It had the highest caseloads and expenditures in the state history of Medicaid, and there was a huge desire to improve health outcomes for the population. The purpose of the ACC program is to be Medicaid's platform for reforming the healthcare delivery system to achieve what we call the triple aim, which is really in three main points, which is on the slide, the visual on the slide, which is really to improve population health, to enhance patient experience, and control costs. And this, in addition, by looking at those three key components, will provide better value for the Colorado taxpayer and help reduce costs with Medicaid, but at the same time improve health outcomes. The ACC program vision is to reform the healthcare system to focus on service delivery coordination via care management. So it's really about each member having a care manager that they can contact, having that care manager really work between what we call the neighborhood or the medical community, and help make sure the member or patient is getting their needs met, not just on the physical side, the behavioral side, and also their social economical challenges that they may be experiencing. It's to ensure a focal point of care for all clients. And in addition, which I will talk about later, we're really looking and introducing unprecedented data and analytics into this program to really track the health outcomes of the population in Medicaid and to ensure program success. Now we're going to cover the RCCOs, or the Regional Care Collaborative Organizations, that are under the Accountable Care Collaborative Program. The RCCO's responsibilities are to improve overall health outcomes of enrolled clients, or from a provider perspective, that would be patients, to provide network development and practice support. So each RCCO has a network of primary care providers that are in their network, and the RCCOs are responsible to provide support and also ensure an adequate network for the members enrolled in their RCCO region. Medical management and care coordination, so to collaborate and coordinate care coordination for members in the program, and accountability for reporting and quality and financial outcomes of the program. Now I'm going to go through the RCCO regions. Under the Accountable Care Collaborative Program, the state has 7 regional care collaborative organizations which are the RICOs. So Region 1 is Rocky Mountain Health Plan. We, Colorado Access, have Region 2 and Region 3 and Region 5. Region 4 is Integrated Community Health Partners. Region 6 is Colorado Community Health Alliance. And Region 7 is Community Care. Now we're going to talk about what we call a PCMP, which is a primary care medical providers in the program. It's really about providing a medical home for the ACC members, which are their patients. There's medical home standards that are looked at, which are really ensuring timely access to comprehensive primary care. It's whole person oriented, coordinate care across systems, and culturally and linguistically sensitive. And there are also some access to care standards about members or patients in the ACC program about getting into appointments on time or in a timely manner based on need. Now we're going to talk about PCMP payments. So all the PCMPs are the primary care medical providers that are contracted to participate in the RICO program receive an ACC medical home payment. This payment is a $3 per member per month payment from HIPAA to serve as a medical home for members/patients that are enrolled in RICO and attributed to their practice. Now we're going to talk about Key Performance Incentive Payment, KPI payment. $1 was placed into an incentive pool for all enrolled Accountable Care Collaborative members/patients. Incentive performance payments are made quarterly, and they're based on how well KPI metrics were met regionally. So each RICO could receive a different KPI performance incentive payment. At a practice level, practices are eligible for KPI dollars based on how many RICO/ACC members are attributed to their practice. And providers continue to be paid the fee-for-service Medicaid for medical services rendered. So now we're going to go through the statewide data analytics contractor, which is known as the ASTAC. As noted in the blue section on the slide, the ASTAC web portal went live in February 2012. If you hear Trail Solutions, that's the same as the ASTAC. They were awarded the contract to create the system to manage the data. Their primary responsibilities are to be a data repository of fee-for-service claims history for all ACC enrolled members, provide data analytics and reporting, support a provider web portal, and provide the departments, the RICOs, and PCMPs with actionable data at both the population level and the client level. So the ASTAC is really monitoring or providing information on how a RICO or the program success from the department level or provider is performing based on the key performance indicators that are outlined in the contract that all RICOs and the ACC program are working at reducing. So the key performance indicators that are active today are really reduction of emergency room ER visits, 30-day all-cause inpatient hospital readmissions, to reduce high-cost imaging, and we are just adding, which we're in December now of 2013, but we're adding in the well-child visits for kids from birth to age 20.
We're going to the care manager. The last time I admitted this patient, so frustrated that she came through the ER again with the same complaints, and she has real pain, she has real issues, but I wasn't convinced that the answer for her was to continue to admit her to the hospital.
Just keep admitting her.
That's not the solution. That is not the solution. Right. And I remember going to the care manager at NCMC at the time and saying, can we get a multidisciplinary community of people around the table to talk about how can we do better by this patient?
Right.
Because I'm not sure that admitting her 5 times a month is the right answer.
Right.
We're not fixing what's going on with her. And I remember the response that I got was, you know, the RCCO is coming, but it's not here yet.
It's not here yet.
And we don't quite have the tools yet
Yeah.
to do that kind of care management. But now that it's here, now that so on the other side of that, now that I am your assistant medical director, the difference that it makes for these patients is profound, truly profound.
So now we're going to look at member enrollment and how a member is enrolled into the ACC program. You'll see the flow diagram on your slide. This diagram is really just a high-level overview of the enrollment process and how a member is enrolled into the RICO program. First, the state looks at if they're eligible for RICO or not. Today, patients or members that are not eligible for the RICO program are if they're enrolled in Medicaid managed care programs. Clients that are eligible for both Medicare and Medicaid, and we kind of talked about that, we're in the CMS approval process. So if that all goes well, then we would have the Medicare, Medicaid eligible individuals or persons in the program. Clients residing in an institutional setting, for example, nursing facility, and that has to be within the last 3 months. If they do not meet any of those qualifications, then yes, they are enrolled into the RICO program. Once they're enrolled in the program, the state really has this process that they call attribution. And what attribution is really looking through the claims history for that member or patient and seeing if they show any connection to a medical home or a provider that's in the program. So it's really linking the patient or what we call a member to a provider. Once that occurs, the members or patients are sent out what we call a passive enrollment letter. So the state sends out a passive enrollment letter to all members telling them that they've been enrolled in the RICO program. But at any point during that process, they can call and opt out not to participate in the RICO program and look at participating in a different plan. If the member has not opted out within 90 days, then they are enrolled in RICO. So no, they have not opted out. They would be enrolled in a RICO. And which RICO they're enrolled in is really based on the county that they're residing in and which of the 7 RICOs they would be placed into. If, yes, they did opt out of the program, then they're enrolled in another health plan. All members, once they're in a RICO program, so once they become a RICO member or patient, all RICOs are contractually required to send out new member materials. In addition, the state sends members a handbook that really gives them an overview of the program. As a RICO, we send out the members or patients a welcome letter introducing to the program, letting them know we're the Regional Care Collaborative Organization. We provide them with a provider directory and some other additional information about the program.
Taking me from committing suicide, turning my life around, giving me a will to live again. All my medication needs being met and up to date, making sure I get all the medical help, all my mental help, taking me from the streets of substance abuse and alcohol to where I am sober for 6 months and continue to stay that way and quit smoking and just totally turn my life around. And I keep continuing to be that way. We meet on a daily basis right now, and I've just been having the best time ever.
Now we're going to talk about keeping healthcare local and how the ACC program is really about keeping healthcare local within the state. So keeping healthcare local, there's 3 kind of components. First, it's really looking at the data, but the data is really looking at it at a regional perspective and within each of those RICO communities. So it allows for informed decision and interventions to help patients make better healthcare choices, drives a different relationship and conversation between the healthcare provider and the members. So it's really at a regional level. And so, for example, in the rural area, when looking at the data and the analytics, it may look a little different for those patients or members in that area than a metropolitan area such as Denver. So it really helps providers make informed decisions based on their regional area. It also is about promoting care coordination, so promote members' independence and self-advocacy in navigating the healthcare system, and really looking at reducing duplication through coordination of care services within the region. And then we look at service coordination, which is really moving to the next level and really looking at reduction in systems, fragmentation, and improve overall health outcomes for the members and patients in the ACC program. So it's really about doing what's right for each community. The goal is to leverage and expand upon the strengths and connections of the local healthcare community, have local leadership really working together in a collaborative model built on relationships, working toward trusted efficiency in systems of care and services created by working together and across systems. And each RICO really looks different in each community, and it's based on what's needed in that community and what are the healthcare needs of the individuals or members in the RICO program in that community.
It's going to mental health issues, going to physical issues at the same time. A lot of people that suffer from post-traumatic, I think it would be awesome for them. Bipolar people. I've seen a lot of people out there on the streets that they're so mentally sick, and the doctors are trying to prescribe them for a physical thing. And then the doctors are frustrated. Then mental health is trying to prescribe them for a mental thing, and it's physical. So by doing this, they're all like on the same page on what to do with that person. I think it'd be great for anybody that's having any kind of hard times mentally or physically, that they should get in here and get on this program. Even if they're homeless, like I was homeless for a couple of years and I couldn't get help anywhere. And I think if I would have been in this program at that point, I would have been fine. I would have been in a shelter and getting assistance and then getting into the proper care I needed for as far as housing. And at that point, I didn't have disability. So, I mean, I was running around like this, you know, in a wheelchair out in the snow, homeless. And coming into this, and I mean, they even help you like with LEAP. They help you get your paperwork and stuff together. It's fantastic. You know, sometimes when you have mental problems or physical disabilities, you can't sit there and concentrate on an application. You can't do it. There's no way. You know, some questions I look at it and I'm like, didn't you just add? And then I get mad and I'll rip the paper and then I'm like, oh, then I have to go down and do it again. Where they have a person here that does that. He'll sit down with you and be like, okay, what do you need? You know, do you need this? Do you need this? Plus any specialists, respiratory and that, they come into my home. They help arrange to get on the same page with one company, so you're not getting your respiratory from one person, your respiratory care from another person, and then your nursing care from another. It all works together.
And remember, we're here to help. If you would like to contact Amy directly, her contact information is on the screen. If you have any general questions, please send them to my.rico@coaccess.com. And for additional resources, be sure to check out our webpage at www.vc3.coaccess.com. On behalf of all of us at Colorado Access, thank you for watching.